Hello, I'm Ben Connor, Secretary to the UK COVID-19 Public Inquiry. As we begin 2026, we're entering what will be a busy and highly significant 12 months. 2025 was a big year for the inquiry. We held public hearings for 6 investigations, modules 4 through to 9. We heard evidence from more than 250 witnesses. And we closed Every Story Matters, the largest public engagement exercise ever undertaken by a UK public inquiry. More than 58,000 of you told us your pandemic stories via our website or at public events. We also published our Module 2 report, containing Baroness Hallett's findings and recommendations on core decision-making and political governance during the pandemic. We're hitting the ground running in 2026, and I wanted to share our timetable for the busy year ahead. This February marks an important milestone as we'll begin 3 weeks of hearings for Module 10, our last module, which examines the impact that the pandemic had on society. This investigation focuses in particular on bereaved people, key workers, the most vulnerable, and on the mental health and well-being of the UK population. Visit our website and register if you would like to come and sit in our public gallery at the Hearing Centre here in Paddington, London. Or you can follow live proceedings on our YouTube channel, where you can also watch recordings. Following the end of the Module 10 hearings in March, we will publish 5 more reports, each with recommendations, over the course of 2026. These will draw on the vast amount of evidence gathered during each of those investigations. In March, we will publish our Module 3 report on healthcare systems. April brings our Module 4 report on vaccines and therapeutics. Summer 2026 sees the publication of our Module 5 report, examining procurement and the distribution of vital supplies across all 4 UK nations. Towards the end of the year, we will publish both our Module 6 report on the care sector and our Module 7 report, focusing on test, trace and isolate. All remaining reports for Modules 8, 9 and 10 will be published in the first half of 2027. We're examining what happened during a devastating pandemic, a colossal health crisis that touched every corner of our society. Each of the inquiry's thorough and evidenced reports follows thousands of hours of meticulous work, drawing on oral and written evidence from hundreds of witnesses and experts, and on the experiences shared through Every Story Matters. The inquiry's chair, Baroness Hallett, will present her findings in these reports, with the expectation that her recommendations will be implemented without delay. We'll be monitoring the implementation of her recommendations, asking governments to publish their response within 6 months of a report being published. And you, the public, also have a role to play. This inquiry is encouraging people to push for the changes we've called for. With your help and support, we can ensure that the UK will be better prepared for the next pandemic. Public inquiries take time. They must be thorough, they must be fair, and they must be completely independent. The UK COVID-19 inquiry is these things, and we're working hard and moving quickly to deliver on each of our investigations. This inquiry's purpose is clear: to create, independently and impartially, a full, factual account of how the coronavirus pandemic was handled across all 4 nations of the United Kingdom, how it affected us all, and crucially, to identify the lessons that will help protect us in the future. Thank you for taking an interest in the work of this important inquiry. Do follow us through our website and social media channels for regular updates throughout what promises to be a really busy year ahead.